Hi, we're back. We're live. Uh, did you find me and just
I'm
share
I'm going to look for you,
the
Grace.
podcast and then hit that one and share it? Let me share it to while I'm doing.
Okay, here I saw you. I'm gonna share it
Yes, please.
to my group, to my page. Oh,
Yeah.
I can't find your. Let me see. Maybe I will copy your link. Just give me 1 minute, Grace. Let me.
Yes, sir. While you're doing that one, I'm gonna talk and
Yes, yes.
welcome people. Welcome to another other episode of Flip Your Switch with Grace. My name is Grace Brucal. I'm a physical therapist, health coach, autism specialist, and emerging functional medicine. So today I'm excited to introduce our speaker, Dr. Jun Reyes, physical therapy, DPT. Um, he has a long bio. Wait, I'm gonna get my list. So Dr. June is based on New York. She is the owner of JC Reyes Estate. Wow. Aside from being physical therapist, she's also an entrepreneur in a real estate. The owner of also an inventor of cream named Dr. Reyes Liniment Cream. She's going to talk about it. She's happily married and blessed with two beautiful daughters. And let me read. Just get along. Okay. He received a Bachelor of Physical Therapy from Emilio Aguinaldo College, where I graduated from. So 1999. So I'm 95. So I'm the ate. I work June worked on multiple settings such as orthopedic, neurological, geriatrics for more than 15 years. She is New York board certified physical therapist and also a graduate of doctoral degree in physical therapy from Stony Brook University and received vestibular rehabilitation. That's our topic. Um, and also he received vestibular rehabilitation training from Emory University. Married to a lovely, beautiful wife, Karina Reyes. So, without further ado, let me introduce Dr. Jun Reyes. Thank you.
Thank you, Grace. Thank you for such an awesome introduction. Thank you for inviting me here on your show. By the way, Grace, you have to accept my request for the Dr. Junra so we can share it on my page. So
Oh,
maybe you
sure.
can, yeah,
Yes.
I can't share it because it's a private group.
Okay, I got it. I approve it.
Yeah, let's see if we can. So everybody can watch it.
Yes. So you're on. Let me check. Go ahead and do your and
Okay. Yeah. So yeah, thank you for inviting me here on your show. Yeah, the topic is why do we get dizzy? So there are so many possible reasons or possible causes of dizziness. It can be a peripheral component or a central component. Fortunately, it's peripheral component is more common than the central component. So to understand why we get dizzy, we have to know the vestibular system and what controls our balance. So there are three components, three systems. There are three systems that controls our balance. We have the visual system, we have the vestibular system, and the last one is the somatosensory component or the somatosensory system. So we get dizzy if one of the system is impaired, if one of the system is not functioning. For example, if we had a medication or a chemotherapy for cancer, it can affect the vestibular hair cells. It can affect both sides, the ear, the right ear and the left ear. So we lose that vestibular function. So the brain is so smart that it can compensate from using other senses, which is your visual and your somatosensory. So if there's any impaired signals or impairment, that would cause to asymmetry of firing. That's when dizziness happen. It means there's misfiring between the other senses. That's why if there's any missing senses or missing system, it would cause dizziness. When you say dizziness, guys, when you say dizziness, there's so many description of dizziness. Dizziness can be described as being off balance. Dizziness can be described as unsteadiness or lightheadedness. Dizziness can be a room spinning or surrounding room spinning, or a vertigo, spinning sensation. So that's why it's very important to know the system that controls our balance. So basically, it's a misfiring. Later, I'm going to show you why there's dizziness. I'll talk to you more about what's vestibular neuritis, what's vestibular labyrinthitis, why migraine or cervical component can cause dizziness. That's why we have, if you have cervical condition, if you have neck pain, why do we get dizzy? So I'll talk to you about that later. Um, so that's why we have to learn more or identify or understand vestibular system and what controls balance. Yeah. So what? That's why we get dizzy.
Oh, so the vestibular part, do you offer that in your clinic?
Yes, I've been a vestibular specialist for more than 10 years. So we offered, when you say vestibular therapy or VRT, vestibular rehabilitation therapy, it's a specialized program. It's a exercise-based program that promote vestibular habituation, vestibular adaptation, and substitution. So we see a lot of patients with benign paroxysmal positional vertigo. When you say benign paroxysmal positional vertigo, this is one of the most common reason why we see patients. We do a lot of testing, not just the Dix-Hole Pike testing, but we make sure we know the diagnosis first. So yeah, I think I see 15%, Grace, 15% of my population of my patients. Yeah,
Oh wow,
yeah.
that's amazing.
Mhm.
Okay. So
So so
so who need this vestibular rehabilitation?
okay, so let me finish so the audience can understand. Vestibular rehabilitation therapy.
Right.
Okay, so let's educate not everyone here is physical. They're not physical therapists.
Yes,
So when
exactly.
you say vestibular rehabilitation therapy, it's a specialized program. It's an exercise-based program where it promotes habituation, adaptation, and substitution. So the key roles of VRT is to promote gaze stability, improve your posture, improve your balance, your ability to walk, and of course, improve your activities of daily living. So the key exercises that we perform as a physical therapist, we not just do head turns, but we incorporate um, daily functional activities like walking with head turns. Like you ask the patients to walk, so you assess the patient. So you ask them to walk and then turn their head side to side, and then you walk up and down with looking up and down. So it's all functional activities, and also to decrease their base of support. So the base of support, you're gonna ask them to do eyes open, eyes closed. Those are the key key components when we exercise the patients. And we also assess, when you say vestibular rehabilitation therapy, it's not just we do that. We have to assess whether the patient, it should be a diagnosed base. It's a customized program. For example, we have to know if it's a bilateral loss of function of vestibular system, or whether it's a decrease in vestibular function. So there's a difference between unilateral hypofunction of your vestibular system versus a bilateral loss of your vestibular component. So it's a specific exercises that we use here at Reyes Physical Therapy. And I also use Dr. Reyes liniment cream. to decrease this to for me, this is just my personal opinion and my patient's opinion, right? So when I use Dr. Reyes liniment cream, I use a certain techniques, and it actually helped the dizziness, Grace, the with the use of Dr. Reyes liniment cream.
Wow, that's
Hmm.
amazing. I need to
Yeah.
have.
I'll send you.
I've been planning to get that cream.
Yeah, you know, in the Philippines, when I sent 700 jars, in less than 3 hours, it was sold out in Shopee. If you can read the testimonies of all our buyers, I don't make money. I don't make money on the Dr. Reyes Linman cream. I'm helping our kababayans, especially our lolos and lolas and the overseas Filipino workers. We help them so they can get better just by doing exercise. I'm not claiming Dr. Reyes liniment cream heals, and it in my personal opinion, it helps my patients.
And that's the good thing with you, Dr. Jun, because
Mhm.
I actually saw you in YouTube, yeah, and
Mhm.
I was really impressed because you have the heart that helps people. You have a heart of gold to really help people. You're sharing like things that a lot of therapists won't share in Tagalog too, so you could reach out all the kababayans. And that's the special trait that I like. That's why I get so inspired. You are the first actually that really inspired me and pushed me. One of the therapists that really pushed me to do live and have this show because I want to be a speaker, but nobody's hiring me to be a speaker. So I just made my own podcast.
I love your podcast. That's why I'm so excited joining you here. I am like really impressed. You know, you're sharing a lot of health that would benefits our lolos and lolas, right? And
Yes.
the people with neurological carpal tunnel syndrome, as you mentioned about your product that you were trying to
Mhm.
tell me. Maybe yeah,
Yeah.
appreciate it.
Yes, and also I want to also let you know that we are live international through
Oh,
Google TV. So I am one of the speakers there. After getting out of my comfort zone about a month, just less than a month, um, I am now can reach global. We have Filipinos all over the world, from London, from Italy, from Australia, all over Singapore, Asia Pacific. So, Dr. June, with you are really reaching out a lot of people aside from your 200 plus followers. Tell
uh,
me about your YouTube channel, by the way. How did you
yeah.
start with doing that one?
Thank you so much, Grace, for doing that. Yeah, yeah. You know, by doing this global, we're helping a lot of our kababayans. Yeah,
Yeah, especially with this time of pandemic,
yeah, yeah,
my teacher in functional medicine challenged me to really be a good leader in my own community. But now we're reaching all over the world. Viewers, Filipinos. That's why I asked you to do this in English because we have followers also that's can understand our language.
yes, yeah. Isn't it amazing with the Facebook and this live streaming?
Yes, we're
We can
actually
reach around
yes.
all over the world. Yeah,
Yes. With like sharing with this platform,
yeah,
especially StreamYard, it's really you could actually um, have a live to multiple groups. So going back to our topic, which is very interesting. So let's say a certain Lola, okay, let's just make it so simple, have dizziness. So what is the type of dizziness that we are just like, okay, this is just a simple dizziness to a vestibular that need a dizziness that needs physical therapy. So how can
okay,
you, yeah.
yeah. So with our lolas or majority of, I would say, 65 years old and over, most of the time it's a benign paroxysmal positional vertigo. So it means the crystals are displaced in one of the canals. So we have to assess So we're gonna do visual assessment. So we're gonna check the oculomotor testing, so if they can follow, the target, and if by asking the history, by asking the patient, by asking your Lola, how do you describe your dizziness? So just the description of the dizziness. So when you say vertigo, because it's one of the most common, they describe it as the room spinning. So that gives you an idea. And then the follow-up question is, how long do you feel the dizziness? So most of the time, they would say within like 30 seconds to a minute, less than a minute. So when you hear those words, less than a minute, spinning sensation, you know that it's most likely it's going to be a benign paroxysmal positional vertigo. So now we know the diagnosis. We're going to do a Dick sulfide testing. So we have to know which side of the ear. So very important I was trying to speak Tagalog. Now it's very important for the audience to listen. When you say BPPV, we start with the history taking, and then we're gonna do assessment. We're gonna do a Dick sulfide testing. So you want to know whether it's the right ear or the left ear. So now we identify it's the right ear or the left ear. That's when we do the CRT technique. The CRT is your cannula repositioning technique, or what we call Epley's maneuver. It's very easy to perform. I actually have a YouTube video on how to do the Epley's maneuver grade. So those people who are suffering vertigo, they can check my YouTube channel.
Wow, that's amazing.
Yeah.
Like, would like to welcome, if you are watching, comment below. We have Miss Rosario from Norway. She's one of my follower in Flip with
Oh, great.
Your Switch. Is from Norway. We have a lot of people that's watching us from Global TV Network. Thank you so much for allowing me to be a part of your program. And also the followers of Dr. Jun Reyes DPT. It's a page. So if you're wanting to follow Dr. Jun Reyes, and also my Flip Your Switch with Grace. All right. So since the next question is, what is PT intervention? Or you could actually just explain who needs vestibular rehab.
Okay, who needs VRT? Um, Most of my patients, they were referred by doctors, and they were referred if they have the symptoms of dizziness, cervicogenic dizziness like cervicalgia, or patients with balance problem, or difficulty walking or gait problem. So I'm seeing all those patients. So the PT interventions, it depends on that diagnosis. So I'm going to show you some exercises, so we can share this, so they know what to do, right? So for example, if you have a vestibular hypofunction, so it means that's why we get dizzy. For example, we have a vestibular neuritis. A vestibular neuritis is an inflammation of the vestibular nerve. So if you have, for example, if you have weakness of the right ear or the left ear, so the normal firing of your vestibular system is this. So it should be symmetric. So the normal firing would be like this. So if you have a vestibular weakness, the other side is weaker, and then this one is normal. So when it sends signals from your inner ear to the brain, it's not symmetric. So it's not firing at the same frequency. So it's sending misinformation to the brain. That's why we get dizzy. Now, if you have vestibular hypofunction, what you're gonna do is you're gonna let me get breathless.
Sure. Well,
I have different. I have checkerboards. I have. All right. So a basic exercise number one is you can use your thumb. All right. So you're gonna focus on the target. So you're gonna do 30 seconds to a minute. So the target has to be clear. So yeah, that's it, like that. So you're gonna do this,
makes
and
me
then you can do, as you get better, you can go faster, just like that. So we're gonna do this for 30 seconds to a minute. And then the other one is up and down. So you're gonna do up and down
so
for
this.
a minute.
So do I look at my thumb, right?
Yes, you're looking. Yeah, there you go. You
I
know,
vestibular rehab. I get dizzy.
yeah, that's why they told me I get paid by making my patients dizzy. Yeah, the thing is, it's an easy exercise, but it's very hard to follow through. It's very hard to consistently do it. So the key is your dedication. You have to be dedicated with this exercise program. Again, with the checkerboard, this is the checkerboard I'm using here. So the idea of the checkerboard, it stimulates your vision. So it gives you that busy surface area, that busy surroundings. So it represents like people are walking, or cars, those kind of things. So it's harder. It makes it harder for the patients to really um, like concentrate with this. This is challenging for the patients. See, as if you perform that, you're going to be doing. It's going to make you dizzy.
Yes. Am I dizzy?
Yeah, that's it.
Your
So,
service.
yeah, and then habituation exercise. Habituation exercise means it's using repetitive movements or provoking your symptoms. You're gonna ask the patients, what makes you dizzy? For example, what makes you dizzy is like looking down or bending over, or reaching up or reaching down. So you write down what makes you dizzy, and then you do it over and over again. Yeah. So that's
Okay. So
that's your
what
PT
makes you
intervention.
dizzy? Like I have patients that would tell me my husband is the one doing the vestibular rehab. He's a specialist like you. So when I get this patient, they would tell me they have a dizziness even while before waking up. What is that?
Before waking up. So
Yeah. So
tulog pa, they're still sleeping.
already awake, but then even
Like
before
the
getting
moment, yeah, the moment they, um, there are so many. There's so many possible causes. It can be, they have to check if there's their medication, because that can cause dizziness, and also their blood pressure. A lot of patients with diabetes, lalo na especially Filipinos in the Philippines, there's an increase of diabetes cases. Like we're living longer, so you're gonna see type two, a lot of type two diabetes. And if there's a decrease in blood sugar or hypoglycemia, it can cause dizziness. Even hyperglycemia, it can cause dizziness. So those are possible causes of dizziness. And also, central component. We can mention about central component, which is, it's harder to treat, but I don't think it's a central component for that person. Um, Another one is dehydration can cause dizziness. So a lot of
hydration.
factors. If there's any cervical component, if you have neck pain, or if you have severe stenosis or osteoarthritis of your cervical spine, that can lead to dizziness.
Wow, that's a lot of things to really consider, especially with when you're doing with that. So you have to have a doctor's order for this one.
As a doctor of physical therapy, it will save money to make sure when you see your physical therapist or your doctor, make sure they specialize in vestibular rehab. Uh, the main problem nowadays are like, they would see the doctor, right? They would see their primary care doctor. And you know this, especially your husband who's specializing in dizziness. So when they see their doctor, the doctor would say, all right, you're dizzy. You're going to go see an ENT doctor. So the ENT doctor, the ear, nose, throat doctor, is not the specialist on dizziness. So the ENT doctor would ask the patient to go to a neurologist. So they're going to prescribe MRI of the brain, other testing, right? And there you go. It costs you a lot of money, testing, co-pays, and time, where they can just see uh, Dr. Jun Reyes or a physical therapist and perform all those testing, because we can see patients now without any referral. So I would perform those basic testing, visual testing, history, and vestibular assessment. So now I know it could be just a benign paroxysmal positional vertigo. In just one session, I can cure you, I can cure the patient, and that saves you time and money.
Yeah, that's amazing. Now, like those people that can't travel to your clinic, I think there's a website where you can find a vestibular therapist on your area. You could do that too. But if
Yes,
you're
I think
on
it's
New
VIDA.
York, New
VIDA.
Jersey, you go to Dr. June.
Yeah, yeah.
Yeah.
Actually, Grace, I have a patient who travels from New Jersey to see me. Yeah,
Wow.
we're from New Jersey, and yeah, New
I'll
Jersey,
go to New
upstate
York
New
and I
York.
visit you sometimes.
Yes, I'm looking forward. Maybe you can drop by.
Yeah, we're gonna be there September for New York Fashion Show. I'd like to thank Amanda for sharing our video. We have a lot of viewers from different like groups.
Hmm.
So next will be all right. So we've discussed the PT intervention. Can you tell me about more about it, uh,
Okay.
or you wanna add
Yeah.
some more?
So another one, I'm thinking about. I don't think the Dr. Jun Reyes audience are able to watch it. Let me double check, Grace. Huh?
Oh, sure, sure, sure. While you do that, I'd like to thank Marilyn Garcia, Jennifer Barajo, Jayceline, okay, for watching. My daughter's watching. Christine, hi, hello. She is watching from Louisville, Kentucky. Is it? Is it?
Oh, they're not seeing it, but I'll just share it. Maybe Grace, you can send copy of our interview today,
It
and
is
then
actually
I'll just
recorded, so I will share it to you. Don't worry about it.
yeah,
You
yeah.
can
So make sure so they can see you too. So
yeah.
I'm really excited showing this to our audience, so because they're gonna learn so much, and they would see you too. So I've been telling them about you.
It's airing. It's there. I checked it. Yeah.
Okay. Yeah.
Watch.
So the question, the PT intervention. Let's just say it's a cervicogenic dizziness, cervicogenic, and the central component. The central component is patients with who had a stroke, multiple sclerosis or Parkinson's, patients with neurological condition. That those are the diagnosis like that. It's very hard. They're very hard to treat because it affected your main circuit, the main computer. But based on research, and this is based on evidence, that there are some gains. There's improvement on patients who's doing vestibular rehabilitation therapy and patients with multiple sclerosis or patients with Parkinson's condition. They actually improve based on multiple research. So it's an evidence-based practice. Now with cervicogenic dizziness, if they have severe tightness, we have the VOR, your vestibular ocular reflex around your cervical spine. Oh no, the VSR or reflex receptors, the VOR receptors in your cervical spine. So if you have tightness and muscle spasm, because patients are afraid to move because they get dizzy, right? They're just looking down or they just don't want to move. So what we would do as a therapist is we would do some soft tissue work around that occipital area, and then we would do manual traction and manual therapy. We're gonna perform range of motion, and that actually helps patients with cervicogenic dizziness.
Okay. We have a question from the audience. I final see who's watching. I have here an occupational therapist from Texas. Is actually my trainer in nutrigenomics. Marjorie's asked, have you treated patient with vestibular Meniere's disease?
Again,
Have you treated patient with vestibular
how
MENNIERE?
many years? You mean years?
Yeah.
Okay, all right. So I like that question. Meniere's condition. When you say Meniere's, there's an excessive production of fluid inside the ears. So medical physical therapists We don't usually treat patients with Meniere's condition. We have to stabilize it. We have to be, it's usually treated by medication. So Meniere's condition, once it's medically stable, then physical therapists will take over. When you say Meniere's condition, it's one of the most debilitating condition because you experience vertigo. Grace, you experience patients with Meniere's condition experience vertigo for hours, and then it stopped, and then it triggered again, and
Mm-hmm.
then it's usually associated with hearing loss. So vertigo, hearing loss, and then they just don't want to go out. It's a debilitating condition if they have and during the acute stage. Now, by taking medication and then controlling their diet by decreasing sodium or not taking sodium at all, that's going to help minimize the symptoms of Meniere's. Now, when it's chronic, it affected their head movements, their ability to walk. Physical therapists will take over, and if they're here, I can see them.
Yes. Oh, thank you so much about that one. So we'd like to say hi to Gina Lester. She's one of my speaker in my show. She talked about she's a respiratory therapist from
Oh, hi.
Kentucky. We also have a Darashon Rosano from Seattle, Washington. Yay, I'm seeing
Yeah,
somebody from Norway. Yes.
yeah, yeah. See, I
So
love
you
it.
guys, if you have some question, comment below
Yes,
on
yeah.
the so Dr. June can also answer
Yeah.
you.
Take advantage while it's free.
Yeah, it's free, free consultation.
Yeah.
So you want to add some more, Dr. June?
Okay. What else? You can ask questions.
It's amazing. You have a lot of like
Yeah.
knowledge.
Yeah. Basically, I'm here in New York. I'm based here in New York, and I've been doing physical therapy here at in Baldwin, Reyes Physical Therapy. So I've been doing vestibular therapy um, here in Baldwin for 17 years. Imagine that. Okay, so let's talk about the other diagnosis, right? Let's compare. One time I had a patient. You know what he did was using toothpick to clean his ear. Yeah, so that was crazy. So why would you use toothpick? So it affected the inner ear. So it led into infection. So it affected the labyrinthitis. So when we call vestibular labyrinthitis, you would know the difference. If it's a vestibular neuritis and then it's a vestibular labyrinthitis, um, you would know the diagnosis if it's associated with hearing loss. So vestibular neuritis is just vertigo and balance problem. Now, when you say vestibular labyrinthitis, it affects the labyrinth. It has an infection in the entire ear, inner ear. So it affects your cochlea. So so the patient is going to have a problem hearing. So that's the main difference, and it's harder to treat. But basically, it's the same principle, the same exercises. Yeah.
So you've talked about using toothpick. How about using the
The
how do
how do you call that? The
yeah,
ear. Yeah.
can you
Uh,
suggest a safe one? How do you do that in a safe
the
manner? That's very
I forgot how the I use it, but just the external area. I try I avoid to push it because it may cause problem with your inner ear. Maybe the wax is gonna get inside. So I just clean outside. Yeah. Yeah, it's better to have like the suction. You put the suction and then it just suck the wax or something like that. So that's what I use. I try to avoid the going inside because it's gonna cause um, impacted wax, something like that. Yeah,
So
yeah.
that's a basic question from moms. Okay, when they swim, our kids swim, and then there's like a water that you know.
Uh,
What do you do? We usually do this one. Is
Me too. I would do this. Yeah, I would do that. Yeah, yeah.
Twice a day.
Yeah, that can cause some infection, but I maybe I encountered one or two. But another one is the motion sickness. If you go on a cruise and you've been on a cruise for like 7 9 days, and when you get home after going on a cruise, you still feel
Yeah.
that
What's that?
swaying movement. So that's an example of our brain adapts to the surroundings or the surface. So it adapts, it compensates. So that's the effect of that.
So
Uh,
would we just
the
go
brain is
away?
so smart. Yeah.
Would it just go away and we don't know? We don't do anything about it.
Yeah, with the water inside the ear, or the motion sickness, you start with we start with the vestibular VRT. So I perform exercises. It's basically more habituation exercise. So it's a really easy exercise program for motion sickness. Yeah.
We have Nems Glinch from Canada watching, and Mar Rose. Hello, everyone.
Hello.
We have international audience: Norway,
I'm,
Canada,
I'm
Australia.
waiting for my audience.
It's there. I check. It's in
Mhm.
your page, so
Yeah,
probably
yeah.
they're seeing it. But what I'm watching, I'm gonna check who's there and read some if they have questions there too. So eh, tell me about yourself. We've been talking about vestibular. Who is Dr. June? What is your goal in life?
Okay, that's a surprise question, huh?
Yeah,
You didn't give it to me.
I
Um,
usually ask this one, but I'm
okay,
not sure.
the Dr. Jun Reyes. Okay, I'm a father of two. I really enjoy doing this because my goal is to help as many patients as I can. Um, and then I am YouTube blogger. I created this page, Facebook page, and Dr. Jun Reyes PTDPT. So please subscribe or follow us on Facebook. I'm trying to do Facebook Live once or twice a week. And Dr. Jun Reyes, I mentioned I'm a simple doctor of physical therapy, father of two. My wife is also a physical therapist. We used to work together, but she's working at home care physical therapy. But she works here once in a while if I need some help with the patients. We do have so we have 7 employees here at Reyes Physical Therapy. I've been a physical therapist for 21 years. I've been here in the United States for 19 years. So I really enjoy um, helping patients, this is my life. This is who I am. And again, like what I said, um, you wherever you are, or how far you came, how wealthy you are, or how popular you are, how famous you are, you always keep your feet on the ground. So stay humble.
That's the one that I really love with Dr.
Mhm.
John. Is always paying forward, especially to our kababayan in the Philippines. And that's the trait that I really love. I reach out to those people. I pick up my guests with that, with that love for paying or, you know, helping people. Because not all has have that. So I love Dr. June because he would just share his knowledge. I've seen one time he was giving a free therapy.
Yeah, yeah,
Right.
yeah. Well, I did pre 12 sessions. We had, our clinic is close to. We are very close to South Nassau, like that. Like we're close to just one hospital. And some of the nurses, they came here. So I said, you're a frontliner. I have to schedule you maybe once a week. And then I'll give you 12 sessions. And they are frontliners. and I've seen 5 nurses and 2 doctors, maybe more, and it's paying it forward. Now they're referring patients to me.
Wow.
Now they were able to give me vaccine. One of my patients called me and said, "Dr. Reyes, I have Moderna vaccine available for you to get." So I was able to get it. So when you give something without any expectation, without
That's right.
expecting anything in return, those are just classes. When they give you something, that's just in addition to, you're happy doing it, but if they give you something, go ahead, get it.
Yes, I
Yeah,
believe that God will reward you and some
yeah.
people like you too. I know you've been in that center where COVID hits, and you've been helping a lot of this frontliners have their own therapy because guys, after COVID, you have a lot of weakness and you need physical therapy. So I work in a hospital, in an outpatient setting. I've treated also respiratory therapists, nurses with
Mhm.
COVID, and a lot of them have different symptoms, and it's and common is one is dizziness and depression because they cannot do their function
Mhm.
before. There's still short of breath. One patient has a lot of problems. So yes, we need to help each other. Also, I'd like you to give the opportunity to discuss your Dr. Ray's liniment. How can we avail that product?
The
Liniment, the
the
cream.
liniment cream, yeah. Going back to what you're saying, you're helping patients, respiratory COVID patients. Oh, that's really cool. Do you work at the hospital setting, Grace?
Outpatient, but my husband is the boss.
Ah,
He's managing outpatient and at the same time skilled in inpatient.
that's awesome. Yeah, that's awesome. Yeah, so you're a tag team, huh? You're
Yeah,
working
my husband
together.
from Emilio Aguinaldo College is very talented, very just
Mhm.
like you. He's just
Uh,
do live.
yeah, yeah, we're
Push
the same alma mater, right? Yeah, Dr. Reyes Liniment Cream. Let me tell you about how it started. Dr. Reyes Liniment Cream, I did, it's a trial and error. Um, I did mix combination of essential oils and the other components, right? So Dr. Reyes Liniment Cream, I've been using it for 5 years, and uh, on that 5 years, it actually helps a lot of my patients. Instead of me using other brand, it this one is this one helps the best. The Dr. Reyes Liniment Cream, it helps improve their condition, decrease the pain, improve decrease inflammation, and they like the smell. They really like the smell. So Dr. Reyes Liniment Cream, based on my personal opinion, my patient's opinion here at Reyes Physical Therapy, is highly effective for them. And when you purchase this is a homemade, um, and I feel this is the best liniment cream on the market. And you can purchase it by calling 516 Let me actually show you the cream, the jar. Grace, I'm just going to show you the cream.
Okay. We would like to say hi to Ran, Adoration, Marjorie. Okay, and High Park, I think from Philippines.
Hello. Yeah, so Grace,
Looking
this
at that.
one is the Dr. Sorry, I'm promoting my liniment cream on your page, on your
Oh,
show.
you're fine. That's your purpose as a speaker. You've
So
spent your time, so go ahead.
yes, yeah. So this we have two available sizes. So this one is the 8-ounce size.
Mm,
Yeah, and it really smells good. It helped my neck pain, shoulder pain, low back pain, and my kids are using this. So I really love my own product.
of course.
Yeah,
I'd like to try
and,
that one because we're
and
using
then
biofree, sometimes it irritates our patients, so I
Yeah.
like to have that as a sample too.
Yeah, so this one is a travel size, Grace.
Okay.
This is a 2 ounce 2 ounce jar, and I sold a lot of this. They want to send it to the Philippines, and then as a giveaway during like Christmas and how do you call that? Thanksgiving. Yeah, so I got two sizes, one 2 ounce and one 8 ounce. Yeah,
How
so
much is the small?
Grace, if you want to buy it. So this one is $8, and
Oh,
this one is
I like to have one.
25.99. So
That
I'll give you one, and then you can get this one, the bigger jar. So you can use it on your sa clinic mo. You can use it in your clinic.
yes, because a lot of my patients are wanting the biofreeze, but sometimes it irritates them. That one I think is milder and it smells good and it has
Yeah,
like good
yeah,
review. So I will send the
yeah,
link to them and then let them purchase themselves.
yeah.
Of course, guys, this program we don't pay our speakers, but then they're allowed to promote their business because to support we help each other. So guys, if you want to ask more questions to Dr. June, you could reach Dr. June. I will send the link
Hello, yeah.
and also the link where to get the cream. Okay.
Yes,
So
yes.
also if you happen to go to where's your clinic again?
So you can reach me at 516-867-5050. I am based here in New York, Baldwin. And I do have a website. So you can go to my website. It's Reyes Physical Therapy. And excuse me, and you can email me at reyesreyespt@yahoo.com.
Amazing,
Yeah.
amazing. Thank you so much. I know you share this to your team too, to your page. I've seen you have like how many followers do you have?
We have on Facebook we have 216,000 followers, and
Wow.
on YouTube, oh, I just got the Silver Creator Award. I'm just waiting to get it. It's an award from YouTube, reaching 100,000 subscribers. But I have 122,000 subscribers, and hopefully it will continue to grow so more people can learn. So more people will learn and get better. Yeah.
Yes, pa-share naman ng followers.
Yes. Yes. Yeah. I
So,
would like to you know, to all the followers of Dr. Jun Reyes, PT. I love Miss Grace or Dr. Grace Brucal. I love her topic. I highly recommend Dr. Grace. Follow her
click
page and share her videos. And definitely, if with your permission, I would like to share your videos on our. Why don't you make switch this page public? Why don't you? Why is this private?
it was public and then I switched it to private, but I cannot put it back. So I
Oh,
yeah, so but I have a YouTube channel, so all of the speakers or our blog podcast
okay.
is
So
there.
maybe I can share the one on YouTube.
Yes, I have a website too. They could access that group through my website, flipyourswitchwithgrace.com. So I am autism specialist. So my passion is to help parents with kids with autism. I know it's hard, So and also we have a company that also promote nutrigenomics.
Mhm.
That is the study of the food or the nutrients in relation with our genes. Like I'll
Mhm.
just discuss it like I'll take advantage of this one. Like if your mom, dad is diabetic, so you would end up being diabetic. You can change it now with the new science of nutrigenomics. So this company will be open in the Philippines. We're open in 23, 26 countries. So we're inviting more people, health educators to join the company and just help people get better. Yes.
Wow, that's awesome. Yeah, yeah. I would like to learn more about that company, that product. Yeah.
Yes, we have every week we have twice a week Zoom, so
Mm.
you're welcome just to listen.
Okay.
Now the business side is not for everyone because not all likes to do the business, but the product is because we focus more of the root cause of most of the aging process, the root cause of most of the illnesses. So that is amazing. So it's a new science, and a lot of people are loving it and being helped. So let's not talk about me, okay? But Dr. June, I am so impressed of your. What else? I know you are vestibular specialist. What else do you specialize at?
I specialize also doing manual therapy. I'm creating my own manual therapy technique. As a physical therapist, I really don't. I mean, it's good to know the foundation. That's our basic. That's our foundation of performing manual therapy. But being with my experience, I've been doing this for 21 years. So I try to create different techniques. It's what we call eclectic approach. So I'm combining myofascial release with traction or active release technique with other techniques, mulligan technique, myofascial release, deep tissue work, the IPA, International Physical Arts technique. So it's a combination. It depends on the patients. Mackenzie, I like using Mackenzie, doing extension and doing deep tissue work on the patients. So that's why Reyes Physical Therapy is well known here. I think we are the best in Baldwin because we're spending time with the patients. Some of the big chain, they called me, they want me to join them and say, why don't you join us? We're not going to compete against you. I'm a small business and I care about my patients. So I don't want to see 100 patients in one day. I want to make sure that the patients are going to get better. My techniques are really effective, and I spend time with the patients. It's why even from patients from New Jersey, upstate New York, Westchester, Connecticut, they come here and I take pictures. So let's just say, all right, Dr. June, we would love to try. We would like to try your technique, and it helps them and they're willing to pay cash base. So those clinicians who would like to um, use cash base treatment, I think that's the best way to go.
Yes. So we also have Miss Naomi. She's a nurse from Texas. She said hello.
Hello, Naomi.
Yeah, there are my team in the Richard Genomics company. He said you're good looking. Get that get.
Okay, thank you. So I hope I see you guys in the future.
I know we're running out of time.
Yeah.
I have one more question, a surprise question. If I know you have this clinic, you have the cream. What is your ultimate goal in life?
Hmm. Again, a surprise question, huh? Okay, so um, I've been a physical therapist, like I said, 21 years. I own my building. I have two apartment rentals, and it's growing. And it's not just financial. My my goal is to hopefully share as many um, knowledge, share my not just knowledge, but I'm encouraging other physical therapists or other professionals to share their skills, to share their talent for free. Because when you pay it forward, God will bless you. So that's my goal is to even just one person who's watching right now, one of the audience who's a medical doctor or an engineer or a neurologist or respiratory therapist. We only need just one to influence, if we influence just one person and able to help other people, that would be a big help. That would be a tremendous impact to that person, and I think that's my ultimate goal.
Yes, we are in this pandemic. We, as an educator, as a therapist, as a specialist, we just need to help each other. We That's our call. If you, like me, I'm not comfortable doing live, but I have to do this. I have to do this, and inspire people to get better. There is a way for us to get better. Our immune system, boost your immune system. They're free. Sunlight, vitamin D is
Hmm.
proven 94%, 90 to 94% proven to take care of this virus. There's a way, eat less sugar. That's why I've been promoting low carb fasting with Dr. Rojo, because those sugars and carbohydrates are the one depleting your vitamin D.
You're
That's
actually right, Grace. It's about, COVID-19. If you have a good immune system, and of course you're preventing other, exposing yourself. But if you have a really good immune system, just like what you said, um, proper diet, and the one that you're recommending, that nutri nutrigenic,
nutrigenomics,
nut-
nutrigenomics.
nutri nutrigenomics, yeah, nutrigenomics, that improves your immune system. And by improving your immune system, maybe you're not going to be getting COVID 19. I'm not saying COVID 19 is not there, but I think COVID 19 is really a big threat. It's really affecting a lot of people, especially in the Philippines. 15,000 cases a day.
Yes, yes. So mostly of the people that we have a separate, I have a separate topic on that, supplementation related to COVID. Because also a lot of people need to know the basic, what vitamin D is, what things like that. So I have that special topic. So tune in to Flip Hit Sits with Grace. We have more guests coming. I actually have a guest. Let me invite everyone to. On your page, we have a guest coming next week, dementia certified. We have that. We also have mindfulness. Our speaker is Dr. Irish, from Canada. So a
Mm.
lot of people are reaching out. We have a lot of topics that we need to discuss and learn. How to boost our vitamin D. Vitamin D, you have to. Why is COVID very common to frontliners Asian? That it has to do with your color. Now it's not because Filipinos are always in the frontliner, but then it has to do something with your color. When you're
Your
darker,
skin color.
yes, when you're darker, you need more exposure from the sun. Let's say ikaw mas morena kayo, you have more. You need to have let's say pag mas maputi ka, if you're white, you need like 20 minutes. Depends on the altitude pa. And then when you're Filipino, you need more because your color is like a sunscreen. So
Mm.
pag darker pa, the more. Kaya the reason, that's the reason why Asian frontliners. So I recommend, if you're nurse, expose go out during your lunch break, expose yourself to the sun, because that's a way of for you to also protect yourself, and
Uh,
that's basic sunlight.
cool. Yeah.
So I have that special topic, so I'm gonna invite everyone to do that.
Yes. Yes.
Yeah, so I know there's a lot of things to ask. We thank Dr. June so much for your time. God bless you and more
Thank
power to you. And would you lastly invite them to your program,
you.
or
Yes. Yeah, I would like to invite you guys to go to my YouTube channel, Dr. Jun Reyes PTDPT, so you can help as many Filipinos by sharing our videos. So follow us on YouTube, and also please like us or follow us on Dr. Jun Reyes PTDPT page on our Facebook. And yeah, and I'll see you soon, guys. Yeah,
Yes, thank you so much. And I'd like to take this opportunity to thank the Global TV, aired international with international viewers all over the world. Thank you so much for giving me an opportunity to host and be a speaker, a regular podcast speaker here. So, and thank you guys. 1 hour within this is our time, and God bless you, Miss
thank
Doctor.
you. Thank
So
you, Grace. Thank you for the opportunity. Thank you, guys. I'll
thank
see you. Yeah.
thank you.
God bless you guys.
Bless you.